Hello, I'm John Holmes. I am Professor of Medical Informatics and Epidemiology at the University of Pennsylvania, and I'm Associate Director for Medical Informatics of the Institute for Biomedical Informatics at Penn. And I'd like to talk with you today a little bit about artificial intelligence and its place in the continuum of patient care, and some of the things that we need to think about in improving patient care through artificial intelligence. So first of all, artificial intelligence is really a very broad field that encompasses rule-based systems, which are the very early ways that AI was developed and put into medicine, as a matter of fact, starting with something called MyCin, which was an expert system intended to help clinicians decide which antibiotic to prescribe in case of an infection. And nowadays, there's been a lot of talk about this new technology called deep learning, which is built primarily on neural networks, but that's not the only approach. But now that we have the computing firepower to be able to support this kind of very computationally expensive and intensive algorithm and set of algorithms, we're now able to do much more, especially in terms of natural language processing and image recognition. So how can AI be used to improve patient care? Well, there are a number of places where AI has been used already for a long time, actually. For example, in decision support, in helping physicians to decide whether to give a flu shot to a patient who has not yet had one, because a reminder pops up in the electronic medical record that informs the physician or the provider that the patient has not yet received their flu shot. Well, that comes from a set of rules that are actually triggered within the electronic health record database that determines whether a reminder should be sent to the clinician at the time of care. That's just one very basic example. But also, it could be used for patient navigation so that patients themselves can navigate the healthcare system more fruitfully and engage in their care as real partners with their clinician. It also helps in terms of risk assessment. There are many risk assessment tools that are available even on the web to the general public that people can use to determine, for example, what is their risk of a significant cardiovascular event in the next 10 years, given a set of risk factors that they plug into a form which comes up on the web. And then finally, there could be provider extenders, as it were, so that a provider, a clinician, it could be a nurse, it could be a physician, it could be a physical or an occupational therapist, where what they provide to the patient could actually be extended to the patient after they leave the care setting, so that they can continue, for example, with their therapeutic exercises at home using AI to determine how well they are progressing and maybe tailor their program as they progress through their therapy. There are some challenges, however, to using AI in patient care, and this is something which is really important to a lot of us working in AI. There's a wonderful quotation that comes from Eliezer Ludovsky, who's a well-known artificial intelligence researcher, who said, by far the greatest danger of artificial intelligence is that people conclude too early that they understand it. And part of this is because so far we haven't really spent a lot of time talking about how to make the results of AI explainable. In other words, how the artificial intelligence algorithm or approach or whatever is being used that uses AI is actually doing its conclusion or making its conclusions. And this is absolutely critical because so much of the work that's been done in AI so far doesn't really look so much at the data upon which, especially machine learning algorithms, reach their conclusions. So data, in fact, can be very full of bias, depending on how the data are collected and how the data are represented, but yet we rely on them when we're doing anything involving machine learning and supervised learning or unsupervised learning or the like. So, and on top of that, there's also a lack of really robust initial and then ongoing evaluation. In clinical care, this is incredibly important because patients change over time. Diseases change over time. Our experience with COVID over the past 3 or 4 years has definitely brought this to the fore. And then finally, there is an over-reliance on AI artifacts, which actually worries me as an AI researcher, because there's a lot of hype right now in the press and general media about how wonderful AI is. but nobody is really talking about really truly how wonderful it isn't. There are some things that we need to work out in the AI community. So I've been working for the past couple of years on this whole issue of explainable AI. In other words, can AI artifacts actually not just give you a prediction, for example, or a classification of a patient's condition, but can it tell you how and why it reached those conclusions? So one of these ideas that I've been working on for some time is a 4-point algorithm, as it were, to think about interpretability, number one. Are the results interpretable by a clinician and also by a patient? And how about a second one, which is understandability? Can somebody understand what the AI system is telling you? Then also, is the system itself usable? Is the AI that's embedded in a clinical prediction rule, for example, is it actually usable? And that is actually a very important problem for us right now, because a system might not be very usable if it just only gives you a number, if it only tells you your risk of that cardiovascular event in the next 10 years is X. That might not be particularly useful to somebody either. So usefulness is actually the fourth topic that I think is really important in thinking about explainability. So I think that as time goes on, and certainly the effort has already started, over the past couple of years, not just with me, but a number of other people, especially in Europe, have been very interested in this whole concept of explainable AI and how we can improve AI to be much more useful, much more usable, understandable, and interpretable, both for clinicians and patients, and in fact, the general public. If you'd like to learn more about this topic, please join us at the Penn AI Tech website. Thank you.